Good evening, everyone, and welcome. We are going to be talking about nutritional deficiencies and how to tell if our bodies has them. This comes from an article by Dr. Jocker about the 5 body signs of nutritional deficiencies. If you have any questions, please feel free to give Dr. Udani a quick text. Jot down her number. She'll be happy to answer all of your questions. I wanted to welcome Dr. Udani. She is our naturopathic doctor here at Justine Blainey Wellness Center, but she's also my naturopathic doctor. And she is very passionate about working with all different individuals of backgrounds. And she genuinely believes that you have the ability to make healthy and long-lasting changes. And she's very patient about it. Please help me welcome Dr. Udani.
Thank you so much, Angela. Good evening, everybody. Welcome to this amazing talk that we're going to have tonight. Before that, let's jump into some of our amazing and exciting upcoming webinars. So we are having a really good talk on overcoming procrastination through affirmations with Dr. Justine. I love affirmations. I think they're so powerful. So please tune into this talk. We're also going to be having a little bit of demonstration about strengthening and protecting your spine when deadlifting coming up. We have a cell defense workshop, as well as how to find the correlations and connections between the toxins and your immune system coming up as well. So these are all weekly talks. Please tune in, and they're all always free. So let's jump right into this amazing and really fascinating talk about the 5 body signs of nutritional deficiencies. So what are the nutritional deficiencies? Sometimes, honestly, these can be very tricky to find because a lot of times, they don't necessarily, or they aren't huge signs of something going on and something's wrong. So if you're not really aware of your body and how it's functioning and it's working, you might miss these, So when you miss these, and over time, this can pile on top of each other and can actually lead to more severe diseases and illnesses like, autoimmune conditions, digestive issues, heart disease, high blood pressure, and such and such. So that's why we want to stay on top of these signs of the nutritional deficiencies. So it can show up in your eyes, in your muscles and joints, in your hair, your skin, your teeth, mouth, nails, and of course, your emotional, mental state as well. So there's a lot packed into this talk, and we're going to jump right in. So what is the first sign of a possible nutritional deficiency? Think your hair and your nails. So usually our body is extremely efficient, right? It's always doing its best to use the energy wisely, use the nutrients wisely. And of course, we have our organs are a lot more important for survival, right? Our brain, our heart, our lungs, and our digestive system, our nervous system. It's of course more important for survival compared to our hair and our nails. So some of the first signs of a nutritional deficiency can show up in your hair, your skin, and your nails. So it's because, hair and skin and nails aren't necessary. Of course, it's great to have, but it's not really needed for survival. So our body will take those nutrients away from the hair, away from nails and skin, and use it for our more important organs, like our heart and our brain. So what are some things that can cause hair loss and other nutritional deficiencies? When you have a very, very, very low calorie diet, so let's say you're trying to lose weight and you're cutting out a lot of foods, a lot of fats, protein, carbs, you're actually going to end up reducing the amount of nutrients that you're absorbing as well, because that will be important for hair. And this can also can cause, especially yo-yo dieting and extreme dieting, can cause thyroid problems that can cause hair loss. Having low protein in your diet, because our hair is made out of protein. So we need protein in order to have healthy hair. Of course, if you're also low in iron, so iron is so important for our red blood cells, for because that helps the red blood cells carry nutrients in the body. It's important for oxygenation. And so when you have low iron, you might notice that your hair is thinner or you're losing more hair. Zinc deficiency is another big one. It can really cause weak hair, also acne and such, because zinc helps with healing your skin and also with making your hair stronger. B vitamins, think biotin. That's also very important for hair strength and hair. And when you are low in B vitamins, like biotin and B12, you can experience hair loss. Vitamin D, I always talk about vitamin D. It's a very important one, especially if you've been diagnosed with alopecia, which is a autoimmune condition of hair loss. And also, it's really important if you have low vitamin D, you can have thinning hair and increased hair loss. And same goes for selenium and iodine deficiency and not having enough omega-3s. So of course, now this sounds like a lot of deficiencies, right? And sometimes we don't know what we might be low in, or what we might be needing more. So this is where it's really, really important to get tested. There's lots of blood tests, lots of comprehensive other tests that I, as a naturopath, can order, so you can find out your individual levels, so whatever you might be low in. So like I mentioned, we want to really check your biotin levels, because so I'm sure you've heard biotin is really important for hair and nails, and that is true. And because it's a water soluble B vitamin, when we take it in, and if it's not used up, it just gets peed out. So we do need a steady supply of biotin in our food or as a supplement to help with our hair and as our skin too. So a lot of times when you are low in biotin, you might notice that your hair tends to be thinner. You might also notice you might get some skin problems, because when there's B vitamin deficiencies, there's a lot of dry skin, a lot of cracking reds. Sometimes there's redness in the skin can happen as well. And because B vitamins are so amazing at increasing your energy, helping with DNA synthesis, making sure your cells are working well. So, and also producing energy as well. So what are some best sources of B vitamins, including biotin? Is eggs, amazing source, wild-caught salmon, sweet potatoes, nuts and seeds, grass-fed meat, mushrooms, cauliflower, and honestly, organ meats can be very, very high in B complex, B vitamins as well. So what can happen is like I mentioned, you really want to get tested if you are suspecting that you're deficient in some of these vitamins, because sometimes, we might not, if we don't know what you're low in, and we're just shooting, blindly in the dark, we might not be actually helping your body. So usually when biotin is low, so other B vitamins in the family are also low as well. So there's many different B vitamins. So there's B1, B2, B6, B5, folate, B12. They will also tend to be low too. So if a patient comes in to see me with complaining of fatigue, complaining of hair loss, skin problems, and brain fog as well, supplementing with the B complex might be a good idea that I would recommend. But this, of course, depends on you. So this is why it's really important to get tested first, or come in for a in-depth intake to make sure this is right for you. So what is the number two? Number two is problems in your mouth, okay? Oral health problems. So this can include cavities, canker sores, smelly breath, or a white coat on your tongue, constant sore throats, all of those things are telling me and other healthcare professionals that something is going on in terms of some nutritional deficiencies. So what can happen is when you are eating a lot of sugar, right? It's feeding the bacteria, and the bacteria in turn releases a lot of acidic molecules, which can actually increase the decay of your teeth enamel and can lead into cavities. So some things that can really help with the oral health problems is checking to see what vitamins and minerals you might be low in. So vitamin C, of course, we need that because it really helps to promote your immune system to keep the cavities away, to reduce your bacteria. And in case you've heard of the old story about the sailors when they're in ships and they just like started to develop scurvy, which was a really, really bad condition that can happen when you have really low vitamin C. So you get bleeding gums and super low wound healing, and can cause even gingivitis. So once again, we need B vitamins for our oral health as well. And calcium and vitamin D is another big important factor for when you have teeth problems, gum problems. So sometimes, we might be able to get a lot of this from our diet. So to keep your teeth healthy, to support that, first of all, we want to avoid too much processed foods, too much high carbs, too much sugar, too much of the acidic food as well that can decay your enamel. So we want to eat an abundance of leafy green veggies because they're really, really high in B vitamins, vitamin K, vitamin C. And we want to have foods that are high in silica, which is like, I think, cucumbers, celery, carrots, because silica helps with the keeping your teeth strong. Lots of antioxidants as well. So the 9 nutrients for healthy teeth and gums are vitamin D. We want to make sure we are good with vitamin D. Vitamin K2 really helps to shuttle in calcium into the bones and teeth. Magnesium is really important as well. Vitamin C, like I mentioned, it protects your teeth and helps with bleeding gums and gingivitis. Lots of bioflavonoids with berries, oranges, and fruits. Collagen and bone broth can also help with increasing the strength of your teeth and of your oral health too. Omega-3 fatty acids and trace minerals and probiotics to keep your breath smelling fresh is also very important. So number 3 is if you get muscle cramps in your legs. Now, sometimes when you have muscle cramp here and there, that's completely okay. Especially, let's say you've been exercising or having you walked for a long time. It's very normal to have muscle cramps. But this is when these muscle cramps are a problem when you have them over a long time. Let's say at nighttime, you can't sleep because your legs are cramping. Or when you're sitting for too long in one position, you notice that your legs are cramping even more. And this is where we want to look into what's really going on here. What's wrong with the nervous system? What's wrong with the muscles? Why are they cramping? So some of the things that can cause muscle cramps are deficiencies in magnesium, for example. So magnesium is so important for so many different parts of our body. So many different systems in our body uses up magnesium. And it's something that I really recommend for many of my patients to take because a lot of us are deficient in magnesium. So some 10 signs of magnesium deficiency is if you have brain fog, or memory problems, headaches, constipation, fatigue, poor sleep quality, like you said, the muscle cramps and spasming, pain and soreness, having irregular heartbeat, lots of numbness and tingling, and even depression and anxiety can be because of low levels of magnesium. So magnesium really, really helps to relax the smooth muscles. Right. So when it relaxes smooth muscles, it can and other muscles, it has a time to reduce those muscle cramps. And a sign of low magnesium is restless leg syndrome, for example, which is when you have really, really restless legs at nighttime. Potassium deficiency can also cause cramping in your leg muscles. Same thing with that when you're not absorbing calcium properly. And having low vitamin D can also be a cause of muscle cramps in legs. Now, with these things, like I mentioned, there are testing we could do. We want to test before we guess to see which nutrition deficiencies you might be low in. So here's some 8 different ways to support if you do get leg cramps and muscle cramps like that. Having an avocado. Avocados are extremely high in vitamin E and as well as magnesium, and you want to have some electrolytes in your body in the form of coconut water or kefir. This will help nourish the muscles and also provide magnesium and other minerals. You can also do 3 or more Epsom salt baths each week. So Epsom salt is super high in magnesium, and so if you have these baths, not only are you relaxing, but you're also just absorbing the magnesium through your skin and into the muscles as well. Using pink salts generously. So these are the Himalayan salts, the Celtic salt, that are very high in trace minerals and magnesium as well. So you're getting lots of those minerals into your body. Like I mentioned before, lots of dark green leafy veggies daily, very high in the minerals. Stay well hydrated, lots of water. I always have my water handy because, if you don't have enough water and you're not hydrated, you're going to get those legs cramping. Staying off sugar and try not to eat too much sugar because sugar depletes magnesium. So for every molecule of sugar that your body consumes, you need about 400 molecules of magnesium just to process that out of your body. So think about that, So if you have a very, very, very high sweet tooth, your magnesium levels are going to be so low. So this is where you will, or you may need to supplement with a good quality magnesium supplement. Now, there's so many different kinds of magnesium supplements out there. So speaking to your naturopath about what is right for you is going to be so important. And you can also use things like essential oils. So, excuse me, lavender, chamomile, rosemary, they have an ability to really relax the muscle and also make you feel more relaxed in general too. Number 4 is itchy, red rashes, skin, acne, and blemishes. So like I mentioned before, our hair, our nails, and our skin aren't necessarily considered survivally important for the body, right? So when we don't have those nutrients, when we're not taking it in and absorbing it, it's going to take from other areas in our body. So we might notice that you get flare-ups of eczema, psoriasis, lots of acne, and skin blemishes because of deficiencies in vitamin E, vitamin A, vitamin D, and also GLA, which is a gamma linoleic acid, which are very important for healthy skin. So what are some strategies for reducing acne? Now, I love working with acne patients because I myself used to have acne, and I know it is such a stressful condition. It really affects your self-confidence, and there are so many different ways to holistically heal from acne as well. Number 1, you want to make sure that we stay hydrated, and we want to have good hygiene. Maybe even try an elimination diet, such as cutting out dairy, gluten. Now, you want to have a coach when you're doing this because we also might want to improve your zinc levels, your vitamin D levels, other important minerals you might be low in. That's preventing your skin from healing. Improving your stomach acids is also really important because without adequate stomach acid, you're not going to be absorbing the minerals and the vitamins that will be recommended. So there's a lot of different ways to tackle skin problems, including acne. Speaking to your naturopath, you can figure out the right way for you. So let's talk a little bit more about skin problems. So vitamin A deficiency is a very, very common deficiency in the world right now. So there's different forms of vitamin A. So if you heard of retinol, retinoic acid, these are commonly used on the skin to increase and to reduce wrinkles, basically, because by increasing your cell turnover, you're letting go of older skin cells and getting the newer skin to come up to the surface. So you tend to look younger, less wrinkles and such. But there are other benefits of vitamin A too, not just for that. Yes, it supports your healthy skin. It's also a very powerful anti-inflammatory that can reduce oxidation and inflammation. It can also prevent cancer. Of course, it can improve your eye health because vitamin A and beta carotene are really good for improving your vision, supporting your immune system, and healthy gut lining. So lots of times when you are low in vitamin A, you might be experiencing acne or other kind of skin conditions. So sometimes it could also be because of vitamin D deficiency. So like I mentioned with the hair, skin can also be a sign of vitamin D deficiency. So acne patients, for example, tend to actually have lower levels of vitamin D compared to patients that have normal or healthier skin. So checking your vitamin D levels, checking your vitamin A levels and your B12 levels and such is such a big, the best way to figure out where are you in the spectrum and what do we need to give your body. So like I mentioned with acne, low vitamin D can also cause more severe eczema symptoms as well. So what are some remedies that we need? So vitamin A, vitamin D, we may need to supplement with those if you are experiencing a lot of skin problems, a lot of acne problems and blemishes and such. Of course, supplementing is one thing. You can of course get this, a lot of it from diet as well, including because both of these vitamins are fat soluble. You're going to find them a lot of in the fatty fish, cheese, dairy, and such and such. So because acne can sometimes be made worse by dairy, I say to avoid it as much as possible in the beginning stages, and then we can slowly add that back. But sometimes you might need a supplement, a good quality supplement in this case. And of course, we want to really work on our gut as well, because if your gut is not healthy and there's inflammation, you're not going to be absorbing these nutrients and minerals and such. So we want to test first. Then we want to fix the gut, for example, to make sure it's going to be absorbing all these vitamins and nutrients. And then we want to recommend some good quality, high quality vitamins and products and such and such. So number 5 is having abnormal sensations in hands and feet. So if you notice your hands and feet get tingly or cold, then there is a high likelihood that you might be low in vitamin B12, because B12 is really important for your brain, for increasing your memory and increasing your reducing brain fog. It is one of the most classic symptoms of B12 deficiency is also fatigue. So just feeling really tired. You might also notice hair problems, and increased hair graying of the hair can also be because of B12. Chronic pain, so muscle pains, joint pains, infertility, blood disorders like anemia, that is because of B12 anemia, can be one of the reasons as well. So there's different kinds of anemias: iron deficiency, iron anemia, as well as deficiency because of B12 and folate. So it's very important to get tested with blood work to see where you are in your B12 levels. So one of the reasons why you get the abnormal sensation in hands and feet is because B12 is really important for nerve signaling and pathways. So if you're low in it, the nerve signaling and firing doesn't work as well. Folate, vitamin B9, it works very well together with B12. So there could be, if B12 is low, you're most likely to be also low in B9. So, and actually you need a proper digestive system in order to absorb B12, especially in the gut. So if you are using a lot of antacids, or you have low stomach acid, you won't be absorbing B12, iron, and zinc as effectively as if you had a better stomach acid. So B6, once again, is another amazing part of the B vitamin family. Really, really important for energy, for neurotransmitters, so serotonin, dopamine pathways. And it's really also important for your liver to helping with detoxification. So once again, if you are low in B vitamins, it can actually cause a lot of problems. I'm sure like you're kind of understanding now how important the B vitamins can be for the body. So some remedies is, of course, we want to first get it tested to see, are you really low in these vitamins, or could it be some other cause? And then we want to figure out if your digestive system is able to digest and properly absorb this, because if it's not, we won't be able to properly supplement these nutrients. There is lots of great organ meats, dairy products, poultry, and a lot of foods these days are they do have they are fortified with B vitamins. But some vegetarians and vegans may be at an increased risk of B deficiency, especially B12, because B12 is mostly found in animal products. Mostly, if not all of B12 is found in animal products. So because of this, they might have they might be low in B12 and may need to take supplementation. And once again, I mentioned, if you don't have a proper working gut, so inflammation, bloating, diarrhea, constipation, that can really, really increase your chance of nutritional deficiencies too. So here, let's talk about the reasons for these nutrient deficiencies. So we're going to talk about nutrient deficient diets. If you're not eating the right foods, of course, you're not going to be getting it into your body. Then having low stomach acid levels really, really makes it harder for these nutrients to be absorbed. Having a leaky gut syndrome. Like I mentioned, lots of inflammation means that these nutrients our cells aren't working optimally to absorb these nutrients. Having blood sugar problems. High blood sugar depletes your magnesium, and it actually prevents proper transportation of the nutrients in the body. Chronic stress really depletes nutrients, and having a high toxic load once again depletes our nutrients because our body's using it up to calm down this toxic load and detox the toxic load out of you. So there's many cases, and this is why as a naturopath, I love seeing my patients and having my intakes with them for about an hour, because we really want to get to the root cause of your symptoms, right? So your symptom might be hair loss, and it might be because of you're low in iron or B12, but the real root is because your stomach acid is low, or your gut isn't working well to absorb these nutrients. So I really like to go to the root of the issue, because once we fix that, we'll be able to help your body heal and for your symptoms to get better. So number one is poor diet. Of course, if we're eating lots of sugar, lots of processed foods, conventionally raised meats, high in antibiotics, growth hormones, farm-raised fish and seafood, processed foods, trans fats, and of course, inflammatory oils, this is not going to promote health. This is promoting inflammation. And it's actually it actually makes things worse, because we might already be low in nutrients, but if we're having lots of inflammation, it's like a fire, right? It's using up whatever we have left as well. So it's preventing us from getting enough nutrients in the body, but it's also absorbing and using up all the nutrients that we might already be low in. So it's a it's a lose-lose situation. So making sure that our diet is improved, even if it's one habit at a time, even if it means you're just cutting out your sugar, the cookies you eat by half every day, or you are switching from cupcakes and cookies to a healthier protein shake, or even if you're switching out your vegetable oil, canola oil, to olive oil and coconut oil, or if you are, instead of using lots of processed conventional fruits, even if it's one little switch and you do this, you add a new thing every week, this can make a huge difference in helping your body absorb the nutrients that it needs. Number two is chronic stress. So chronic stress is just like inflammation, right? Chronic stress leads to inflammation, and it can really wear and tear in your body and use up the nutrients that we already have, and also prevent us from absorbing the nutrients that we need. So when we're stressed in the body and the mind, usually our body goes into fight or flight, right? It does not have, our body says, I don't have time to digest. I don't have time to sleep. I don't have time to relax. I am stressed. I'm on a schedule. I need to get A, B, C, D, E, F, G done. I'm on the road, right? So when your body's in that stage, it doesn't have time to absorb nutrients. It doesn't have time to heal. So our digestive system actually tends to shut down. So we don't get the digestive juices that we need to help break down the foods. And we also tend to not eat that well when we are stressed, right? We go for the cookies, the candy, the carbs, which can already be low in nutrients. We might have sleep problems, and when we have sleep problems, that really also mess up our cortisol. And our cortisol is high anyways because we're stressed, so that can also reduce absorption of nutrients, and affect our gut motility too. This can lower our immune system and can result in overgrowth of bacteria, harmful bacteria that can result in even more inflammation. So you can see like a lot of this is like a domino effect. So we want to really, really work on reducing our chronic stress, and providing your body with the right kind of tools to help support it. And this is something that where you will need a coach, because sometimes this can feel really, really overwhelming. And that's why I love working with my patients. I know Dr. Justine loves working with her patients too, because we really want to help you figure out a path that works for your life and your lifestyle. Number 3 is digestive disturbances. So when we have stress, when we have a poor diet, we can really get digestive issues coming on. And even if you don't have some of those symptoms, you can still have digestive disturbances if you experience chronic heartburn, or if you are chronically, if you have thyroid problems, or if you have skin problems. This can all be because of issues with your digestive system. So this is where I love to see my patients, because gut health is number one in my books. If you really fix our gut, you notice our mood and everything else improves so well too. And if your gut isn't working well, we're not really absorbing the nutrients, right? So this will be the first place to start if you have noticed you're noticing symptoms of the stuff that I just talked about, including hair loss, skin problems, muscle aches and pains, and tingling and sensations in your body as well. So now there are lots of things we can do to test. So I've been telling you, there's ways we can test, and there's lots of comprehensive tests you can do, but also regular blood tests that we can get done at the Life Labs, for example. So of course, the tests that are done sometimes with your family doctor isn't necessarily as comprehensive as the tests that I, as a naturopath, might order for nutrients, to check for your nutrients. So there's many tests we can order. This is a great test called the Nutrival, which is a very comprehensive test that checks for various different toxin load, nutrient loads, micronutrient loads, and it is really gives you a full picture of what might be going wrong in your body, or what might be going right in your body. So that way we know exactly the things to support you. So there's this test, and there's also an organic acid test that is also very commonly prescribed by naturopaths to check to see what nutrient levels you might be low in as well. So get tested first to see what you're low in. That way we can provide you with the right kinds of nutrients and nutrient support, because our bodies will definitely tell us of nutritional deficiencies, just like plants. When we see the different signs in the leaves, our bodies are telling us signs like that too. When something is off, some nutrient deficiencies are low, and sometimes it might not tell us for a long time. So this is also where we want to be preventative and proactive and get blood work done, checked up in a yearly way. As a naturopath, I order more blood work compared to most family doctors. Not all. There are many great family doctors out there as well. But sometimes, if you need a more thorough look at your nutrients and vitamins and minerals, I would be happy to do that for you, to get tested for you as well. So this is why, once we figure out you might be low in certain nutrients and minerals, that could be a starting point to figure out what could be going wrong with you, and then finding out solutions that work well for your lifestyle as well. So with this in mind, I do offer free meet and greets. These are 15 minutes of free meet and greet consultation, where if you are wondering how I can help you, we can have a discussion. and discover the natural and holistic treatments that can help you, and how I can best help you with some of your concerns too. So for these meet and greets, you can call the clinic at 905-840-9355 to book, and I'd be happy to talk to you about some of the things I as a naturopath love to do. Thank you so much for joining us for this talk, everybody. I know there was a lot of information, but we just want to give it all to you because this is comes from our hearts, and we hope that you took some away from you at home and was able to implement things. So some of our upcoming webinars are, once again, affirmations. Love affirmations. So we're going to be doing a talk on overcoming procrastination through affirmations. Strengthening and protecting your spine with deadlifting is another great demonstration coming up. We're also going to be doing, myself and Dr. Justine, the cell defense workshop. We're also going to be talking about correlating the toxins in your immune system. So lots of great talks coming up. And we hope that you connect with us on Instagram, Facebook, YouTube, website. We'd love to hear from you. Even if there's a feedback about any kind of topic ideas or reviews, please let us know. We love to give this back to you. And please stay connected with us for our other talks as well.